Hi, my name's Phil. I like talking about politics. And in this video, I'd like to discuss the major new report out commissioned by Labour for one of their former health ministers, Darzi, on the state of the NHS and what needs to be done to get it back into a fit state for now and the future. And the choice of Darzi to carry out the investigation is an interesting one and makes a lot of sense. He has a background, he's a medical background, he's a doctor, but also in politics. So a completely independent investigator would, of course, have identified all of the areas in which reform is needed, and they would have made a load of recommendations based on that. And we know how these things usually work out. The government would have looked at that and then sent it to the Treasury and say, well, how much will this cost? And the Treasury would go, yeah, we're not doing this. So that would have been a waste of time. Whereas Darzi has clearly had guidelines set that, look, we need a realistic plan to reform the NHS that's going to allow for a redistribution of funding, but we're not like doubling the budget, right? And the report has done that. But before going over some of the interesting detail of the report, the first thing I would say is we need to remember what sort of led up to this. David Cameron, one of the things he did was he broke up the NHS and made it all the different bits compete with each other, and it created a huge level of inefficiency. Like the personal experience that sticks out in my mind, there's so many, but I remember after I had elective surgery a few years ago and I needed blood tests every few months just to check. And my GP wanted these results to check, and so did the hospital that carried out the surgery. But both the hospital and my GP were in different trusts. And so, when one did a blood test, the other couldn't just look it up on the system because they didn't have access. So there were some times when I was having 2 blood tests done in the same week. The exact same blood test looking for the exact same things. So, that's 2 sets of phlebotomists or nurses drawing the blood, 2 sets of pathologists analysing it, 2 sets of people who are just like moving the blood around or putting results on the system. That's 2 sets of workers doing the job of one. Now, in a health service that's stretched for resources, that's a bit mad. And, and I've issues like my stepdaughters who've got long-term health problems that the NHS have failed to diagnose. They're constantly starting from scratch. That sometimes they'll go to a consultant and it's like they don't have the last 15 years worth of tests that have been done on them. So they're having to ask them, well, what have you had done and what? The system is a complete mess. Just fixing that would surely boost productivity. Then there's the problem that parts of the NHS deal with that are not their primary role. Lack of capacity in social care means healthcare is picking up the slack, meaning that less healthcare is delivered. But also that social care isn't delivered as effectively. Remember when Theresa May decided she had a cunning wheeze? She would slash the budget for social care. Then the services that were being delivered with that funding, she said, well, I'll tell you what, we'll give some money to the NHS and they can deliver them. But did they get all of that money? No, she didn't just move the money about. She cut the money. She gave a smaller share of it to the NHS and said, right, you do that, even though you're not really set up for it. And do you know what she then did? She had the nerve to say she'd boosted NHS funding. Even some Tories at the time said it was a con. And where one service can't cope, people end up in hospitals. It's a sort of safety net of last resort. When you should go to your GP, but you can't, because you can't get an appointment. So what do? You go to A&E. And there's lots of cases like this where people just end up being dumped in A&E because it's the last place. It's the place that can't tell you to go away until they've actually determined there's nothing they can do for you. Labour have already noted that we've got external issues like failures of housing and education and other seemingly unrelated issues that actually create pressures for the NHS. For example, poor quality housing means health conditions arise from things like mould, which should not in a modern economy. Extra pressure on the NHS. Education can be better used to teach kids about health issues so that you're more likely to be able to live a healthier lifestyle. It was pointed out recently in the wake of a proposal to widen the ban on smoking. Actually, maybe what the government should look at is some of the foods we have available that cause major health problems and tax the crap out of them. Although a lot of people then get fixated on the sugar tax, which I absolutely support, without noting that actually some of the worst foods, it's like the ultra processed foods, but it's also some foods like I think donuts like one of the worst, aren't they? It's that combination of sugar and fat that rewires your body. But anyway, The report on page 69, if you're referencing it, also notes, big issue, the disparity for different groups and ethnicities, and talks about the needs to address this. So there has to be an investigation. It particularly cites, for example, people with learning difficulties have much poorer outcomes. And there needs to be an investigation into not only exactly why this is, but what needs to happen to stop that being the case. Unlike the Tories, who never think of this, they never accept the fact that different demographics should be considered. And a big question will, of course, be about funding. It's everyone's answer to everything. And that's not a particular criticism, because it is obviously the case. If you've got something that's not working very well, anyone could come up with a solution to make it work better that will require more funding, right? So it is inevitable that people will say, well, you're going to need more funding. Lots of processes can be made better there. And even without throwing money at something, all reforms are going to cost something. But we also know that the budgets are going to be tight. So Labour are going to be working on the basis of resourcing will largely have to do, but it's been misdirected. So you've got to redistribute it. Now, there's always some truth in this. And it's certainly true as far as the NHS goes. The report highlights, and this is the key part of the report, really. Particularly, so Keir Starmer gave a speech on it today as well. And as he was introduced, there was a lot of emphasis on this as well. So the report highlights how the distribution of funds is not right, with too much money going to secondary care, which has shown no improvements in productivity for it. So the proportion of the budget that's gone to like hospitals has significantly increased, but there hasn't been an increase in productivity. And primary and community care has been starved of funds. And it's highlighted how, for example, primary care has developed a lot of innovations to work more efficiently. But the report is very heavily emphasising that one of the biggest reforms should be a reallocation of funding to get better results there. So, for example, if primary and community care had better funding, hospitals wouldn't be inundated. So it's not like starving hospitals now. The idea is you wouldn't be inundating hospitals as much because the capacity exists where it should, allowing them to deliver the care they're set up for. Now, I think Labour had been thinking along those lines anyway, because there's a big emphasis on shifting the NHS to prevention rather than just reactive treatment all the time, and how to work best on prevention. Well, that's going to be through community projects, isn't it? But one big question, I'm not sure there's an answer yet, but one big question is, so you can see how, yeah, if you reform this and you'll get better outcomes in the long term, that's grand. How do you fund it in the short term? Because if you're going to shift the focus of care from hospital to community and reactive treatment to, say, prevention, you need to fund the new system at the same time as the old system. For example, while you're boosting this capacity in primary and community care, it's going to take time to set up, to be implemented properly, to be working properly, to get the results. During that time, people are still being sent to hospitals unnecessarily. So you need two pots of money, do you not, while the reforms are being implemented? It's always the case when you introduce a new system. You have to keep the old system going until the new one is online and working. That implies more money needed to be front-loaded, provided in the short term. But I'm not sure Labour are giving the impression that that's the plan. So how do they manage that? Labour have given themselves limited scope for raising more money in the short term. The emphasis is on getting the economy growing again, and from there you'll get higher tax revenues and therefore more funding for other things. Brexit's obviously going to put the brakes on how much we can grow our economy as well. There is a focus in the report on identifying diseases earlier, which is absolutely essential in order to get faster treatment, absolutely. But this is surely undermined by the eye-watering waiting list right now. So what you're talking about is, with the NHS in the state it is in now, to get prevention, what you need is earlier testing. You need actually, sort of almost speculative testing. Health checks, really. Health checks is what we're talking about, where you test for things without necessarily symptoms presenting themselves, which is, should be done. But that's additional onto what's already happening, treating things that have been caught too late. Again, that will need more funding, isn't it? In general, though, spotting problems earlier means not only a chance of less intensive treatment being needed, but a better outcome. So in the long term, absolutely, this is the way to get the NHS fit for the future. It means people are more likely to return to full health, meaning the NHS don't also have to treat secondary problems. Workers can get back up to full productivity, fewer working days lost, and of course more quickly. The report talks about the need for working conditions to improve in order to help staff be more productive as well. So it's not just about pay, that is a factor. It's also about the fact that NHS staff, their working conditions are also poor. The scale of the problem is laid bare in terms of the human cost as well. It says, as a result of long waiting times, it's very likely there are about 14,000 avoidable deaths a year, just as a result of excessive waiting times. We've fallen behind other countries in terms of cancer detection. This was like the worst one for me that came out of what I've read so far. And it absolutely speaks to the conservative attitude to anything. It's like they fund things. They fund day-to-day costs. They don't like funding anything that will improve things in the future. It's always at the short term with them. What do we have to pay out? Anything we don't have to pay out right now, even if it will cause a problem later, we'll worry about that later. We saw that with COVID, we didn't have PPE stockpiles for an emergency. Well, why would we fund? Boris Johnson was told this in 2019 when he became Prime Minister. Well, why would we spend money on an emergency that might not ever happen? And then an emergency did happen less than a year later. Then we didn't have enough PPE. And in the case of this report, what it points out, and this is exactly the same Tory thinking, we've fallen behind other countries in terms of cancer detection. Now, if you want to reduce pressure on the NHS, one of the biggest things you can do is detect cancers earlier. So we should always be funding efforts to do that. And what it said in this report is, in this country, we have made zero progress on the early detection of cancer between 2013 and 2021. There was no progress at all in those 8 years. And the NHS, another issue that's come up, the NHS has not received the capital investment that it should have in order to update buildings and other infrastructure, such as basic equipment, scanning equipment. You know, the overall feel of the report is nothing is working as it should, but that the fundamentals are still there. It's, it just needs to be better managed. But also that there are lots of external issues putting extra pressure on the NHS, for which other government departments, that's why there's this like holistic approach from Labour in terms of things like housing and education, and also that there's a lack of effective use of data. That's another big thing that comes out of the report. In particular, the report says there needs to be proper investigations into making sure, as I say, people with learning difficulties or of certain ethnicities don't get poorer outcomes. You know, the report is being described by the Health Secretary Wes Streeting as, and by Keir Starmer in his speech today, so they've put their heads together on this one, as an honest, comprehensive report. It will need to be, because this is Labour's biggest project, really. The NHS is always Labour's biggest project. Starmer says his priority is the economy. And yeah, of course, that's the biggest concern of voters, mostly because a healthier economy makes everything else better as well. And a growing economy will, of course, mean more funding for the NHS in time too. But there's a symbiosis here. The importance of the NHS can't be overstated. First of all, a healthier workforce is more productive. And if you can catch things before they develop into needing more intense treatment, then actually some people may not need time off work. So if you can avoid illness and injury in the first place, as well as treating them quickly and effectively when they do happen, that is absolutely essential to growing the economy. So you can focus on the economy, but any focus on growing the economy always has to have a focus on an effective healthcare system. So there is this symbiosis between healthcare and the economy, something Conservatives just don't understand. It's why their objections to immigration are so baffling to me. It's like, but if you're going to let your domestic workforce fall sick all the time because they can't afford private treatment, and you fail to treat them, how do you expect those jobs to get done if you also don't want people coming from outside to do them? But it's not just that a strong health service is essential for that top priority of growing the economy. It's also one of those rare situations where voters are in harmony with practical reality. The NHS is voters' second priority on a consistent basis, just behind the economy. Labour need to get the NHS working again for quite a few reasons. First, it is their proudest achievement. It's something that their own supporters, not just members, their own supporters, will always prioritise. Second, it's vital for the general economic health of the nation. Third, it actually provides very easy metrics to be judged on. You can show graphs of like waiting lists, waiting times, deaths by various diseases. And if Labour show graphs of those going down over this Parliament at the next election, That shows progress in an easy to digest format, which is much harder with a lot of other government initiatives. And fourth, the voters will appreciate it if the NHS is made noticeably stronger, and they will notice. Because even when we, on an individual basis, don't need the NHS, we don't need the NHS on a daily basis, or most of us are fortunate enough not to have chronic health problems that need the NHS regularly. But we will often know someone who does at any one time. So improvements will almost certainly be noticed and will be a major factor in voting decisions. But there we are. Those are my thoughts. If you enjoyed the video, please subscribe for further content and click the like button. You can also sign up for memberships if you'd like to support the channel further. Thanks for watching. Until next time, I'll see you later.